So etiology of chronic pancreatitis is very important because in this way we can actually show the underlying mechanism, and this way we can focus on differentiating fixed and modifiable risk factors, and we can focus on targeted therapy, and also etiology has an impact on prognosis of chronic pancreatitis. The most common etiologies of chronic pancreatitis go within the category of toxic, obstructive, autoimmune, recurrent, acute or severe pancreatitis, genetics, and idiopathic. Amongst the toxic or metabolic causes of chronic pancreatitis, the most common is alcohol consumption. 45% of cases with chronic pancreatitis are as a result of alcohol consumption. The next most common is tobacco consumption. Hypercalcemia with a calcium level over 12, hypertriglyceridemia with a fasting triglyceride level over 300, and non-fasting over 500, and medication could explain the other reasons within the category of toxic or metabolic reasons. For the obstruction, could be as simple as pancreatic duct stone, or as a result of like a growth or a mass within the pancreas, or pancreatic duct strictures, or anatomical anomalies such as a pancreatic divisum. Autoimmune pancreatitis is another category that can lead to chronic pancreatitis over time, and these patients, they require targeted therapy with steroids or immunosuppressants. Recurrent acute pancreatitis or severe pancreatitis could be as a result of any of the metabolic causes, or as a result of post-procedures such as post-ERCP pancreatitis. I have to say that despite like comprehensive workup, 20% of cases with chronic pancreatitis remain idiopathic. In terms of genetics, is very important. Who benefits from genetic testing? If despite all workup, the etiology remains unclear, or the patient has family history of pancreatic disease, or they have persistent disease after therapeutic intervention, such as you think that it's as a result of pancreatic duct stone or strictures, and despite all treatment at a younger age, they still have evidence of ongoing chronic pancreatitis, or they're younger than 35 years old, genetic testing is recommended for these group of patients. We have a significant number of genes contributing to chronic pancreatitis. However, in the most actually available testing, they will test for PRSS1, SPINK1, CFTR, and CTRC gene mutation. These are the most common category of genes that they have to be checked in patients with chronic pancreatitis.